Veterinary Daily. I'd like to give a brief overview of kidney disease in cats. This is intended mostly as a review for clients with whom I've already spoken. Chronic kidney disease is fairly common in cats. It is probably the most common thing that we find when we run annual routine blood and urine tests on healthy appearing cats. It is a condition where the kidney's ability to perform one or more of their many functions is diminished. There are a lot of things that normal kidneys do. The thing we think about the most is that kidneys remove waste products from the blood, but they also help regulate a variety of things, including hydration and fluid balance, hormonal balance, electrolytes, acid-base balance, blood pressure, and red blood cell production. As a cat ages, a variety of things happen that cause damage to the cells of the kidneys. As with most other animals, cats do have a lot of reserve kidney function. They can lose half of their kidney cells. They can lose the equivalent of a full kidney, and they still do fine. They lose half of those functioning cells, and they are still able to perform all of the normal functions of kidneys. But when cats lose about 2/3 of the function of the kidneys, they start to lose the ability to conserve water. This is usually the first sign that we see, and it causes the first change we see on our laboratory tests. When this happens, the cats start producing more urine. A lot of times people will notice more urine in the litter box, and they will notice that their cat is drinking more water. Something to keep in mind is that they are not producing more urine because they are drinking more water. They are drinking more water because they are producing more urine. They are drinking more because they have to. That means that the most important treatment for kidney disease is simple. At this stage and in the future, it is important to ensure that your cat always has plenty of water. Water is the most important treatment. If they have only one bowl of it and they spill it, they can become dehydrated very quickly. As kidney disease progresses, we start to see the effects of other functions being lost. For example, toxins may start to build up in the blood, causing the cats to act sick. Or electrolytes may become imbalanced, or the cats might become acidotic or anemic, or they might become hypertensive. With kidney disease, cats are also predisposed to kidney infections, which cause further damage to the kidneys. With all of these things, you may not see any noticeable signs until the disease has progressed, so we recommend looking for things before they become a problem. Realize that doing everything that we recommend does get expensive, but it does end up being a lot less costly than a few days at the emergency hospital because of acute decompensation of the kidneys. Our main goal with cats with kidney disease is to maintain quality of life for as long as we can. Our goal is not to extend the life of a cat who is suffering. And we do ask everyone to keep this goal in mind. If we recommend that you give your cat a pill twice a day and they are hiding under the bed all day in fear of those pills, we aren't accomplishing our goal. That medication may be important, but it is also important that you let us know if it's a problem. Communication is really important here. So, what do we do for kidney disease? A lot of people think that we sell you a bag of special food and that's about it, but there's a lot more that we can do. There's a set of things that I generally recommend doing for cats with kidney disease every 4 to 6 months to look for problems before those problems have a negative effect on the cat. Every 6 months, in any cat with kidney disease, I usually recommend a thorough examination, a blood panel, a urinalysis, a urine culture, and a blood pressure measurement. Radiographs can also be helpful. With these tests, we are looking for anything that the kidneys might be failing at or anything that might be harmful to the kidneys, and then decide the best way to address these things. At the same time, we are also looking for problems unrelated to the kidneys. This sounds complicated and hard, but a lot of times it's simple. For example, if a cat's potassium is low, we supplement it. If they have high blood pressure, we treat it. If they have kidney infection, we put them on antibiotics. All of these things are relatively simple, but can help a lot when they are needed. There's a lot that we can do with kidney disease in cats to help them live a long and healthy life. With respect to food, it's been pretty much shown that a low-protein diet does not help prevent kidney disease in cats, and that it can be harmful. Renal diets are not sold over the counter. This is because they are not nutritionally complete. They are deficient in protein. There isn't any good evidence that changing to a special diet helps in the early course of the disease, and the few diet studies that have been done in cats in the second and third stages of renal disease are, in my opinion, questionable. The most commonly cited study compares renal diets to unidentified over-the-counter, mostly dry foods, which I never recommend feeding to cats anyway. I'm not aware of any studies to date that compare the benefits of a renal diet to a high-quality over-the-counter canned food. And my experience is that cats on renal diets lose a lot of muscle mass and generally look unthrifty. But realize that each cat is an individual and needs to be treated as such. Some of my patients with kidney disease are on special diets, some are not. If your cat is on a renal diet, I am not recommending changing that in this video. There's one other treatment for cats with kidney disease that I oftentimes discuss with my clients, and that is calcitriol. I'm going to save that for another video. Thank you for watching.